everyone, it's Dr. Kim. So in today's video, I am going to talk about vulvas, pelvic floors, and vaginas, and what happens with the aging process. So if this is a topic that's going to offend you or not interest you, I'm going to give you a few seconds to just scroll on past this video. And if you would like to stay to learn about this topic, I'm not going to show you any graphic photos. I'm just going to provide you with some information on a really important topic that we don't talk about very much. So I'll give you a few seconds to scroll past if you're not interested. Okay, so the reality is that the pelvic floor and the pelvic region is impacted by the aging process, just like every other tissue and every other organ in the human body. It can be impacted by childbirth, weight fluctuations, hormone changes in the perimenopausal and menopausal phase, trauma, and some women just naturally don't like the way things look down there. That being said, there is a wide range of normal anatomy in the pelvic region, not unlike how we have a very wide range of normal anatomy for breasts and faces and every other piece of us. So I want to start by reviewing some of the anatomy in the region and then talk about what happens and how we can address those issues, okay? Okay, so let's review some anatomy. This is a picture, line drawing, of what is referred to as the vulva. That is your entire external genitalia. It consists of the outer and inner labia, or labia majora and labia minora. These are the external coverings protecting the entrance to the vagina. We have the clitoris up top, and then the urethra underneath that, which is where you pee. So that may seem elementary, but I do hear people using the wrong terminology, referring to the vulva as the vagina, and I do think it's important that women have an understanding of what their actual anatomy is in this region, especially when we start talking about changes and potential treatment options for these changes. Okay, so here is the side view of our anatomy front to back. So down here, of course, is the vulva that I just talked about, the external lips. We have the sling of muscles here, what we call the pelvic floor muscles, that are helping to support all of the organs of our pelvis. And those include, from front to back, our bladder, our uterus and cervix, and then of course the anus and rectum. This, of course, vaginal canal coming up, connecting to the cervix and uterus. So as we age, as our hormones change, and certainly post childbirth, a few things happen in this area. So number one, this pelvic floor muscle gets, of course, stretched out by childbirth, and that can happen even to women who have C-sections, just due to the increased pressure in the abdomen and, of course, the growth of the uterus. And that can present as leakage down the road. So when you laugh or jump or cough, we've lost that strength of that pelvic floor and we have some linkage, and that can be very disrupting to women's lives and activities. We can have dropping down of the actual uterus and cervix, as well as the rectum and the bladder, so cystoceles, rectoceles, where the organs are actually dropping down and protruding, and that can interrupt continence and also give a sense of heaviness. And of course, as we age and hormones change, the collagen is lost in these structures, as happens everywhere else in our body, and the mucosa that lines the vagina changes as well. And as we get into the perimenopausal phase and the menopausal phase, this can present as dryness, it can present as irritation, it can present with pain as sex, and a loss of some of the sexual pleasure in the area. So these are real changes that happen to women, and they are physiological, they are relating to the aging process. hormone changes, childbirth changes. They are real and they lead to real symptoms. And, for too long, we have not discussed what is happening to women, and it's kind of just been accepted like, oh, as you get older, you're gonna pee your pants a little bit, things are gonna change down there, sex might not be as fun, but it doesn't have to be that way. So let's talk about some of the potential options that we have for some of these symptoms that we start to see through the aging process. Okay, so let's talk labiaplasty. You remember I just told you labia are the external lips. We have minora, which are inside, majora, which are outside. Both of these structures are impacted by the aging process, and both can be impacted by childbirth. There is also a wide variation of natural normal anatomy in that area, including a degree of asymmetry or unevenness from side to side. So women often come into me and they are complaining of either not liking the look or the asymmetry in that area. There may have been some tearing with childbirth or trauma. They may have some irritation in their clothing, and they're looking to even things up and essentially trim the labia. So this can be done in two ways: surgically, just under local freezing. You do not have to go to sleep for this. Two main procedures we do: excision with a wedge, or this trim procedure. Again, local freezing and dissolvable sutures. We can also do a version of the labiaplasty on our laser, and that involves using bulk heating to get contracture of the collagen, very similar to what we do to people's faces to get tightening and lifting. We're doing it to the labia, bulk heating, contracture of the collagen to tighten things up and smooth things out in that area. Now, when we do it with the laser, again, similar to when we do lasering on faces, it's not exactly the same as surgery. We're not getting things as tight, but again, no incisions, no downtime with the laser labiaplasty. However, surgical labiaplasty, minimal downtime, local freezing only, and women can be very, very satisfied with the results that we can obtain from this procedure. Okay, so our Intimalase treatment, this is done on our Photona laser, and it is for the vaginal canal. So we are putting the laser handpiece actually into the vaginal canal using a single-use disposable speculum. And we're gonna do 3 sessions spread out by approximately a month. Very, very similar to how we treat faces with lasers in order to stimulate collagen production, give strength and tightening to the facial skin. In this case, we are doing it along the vaginal canal to improve the collagen in that area, give strength, tightening, and help improve the health of the mucosa itself, which can improve some of the symptoms that we see with menopause in terms of dryness in that area. So we can also do our Intimalase treatment using the same piece of equipment, but in Intimalase, we are only doing the anterior wall of the vagina instead of all the way around. And when we strengthen the anterior wall of the vagina, we are helping to support the urethra and the bladder, which is sitting just in front of the vagina, and improving some continence issues that can happen with aging. Minimal downtime with this procedure. Basically go right back to all of your activities. So this is our Intimalase, and often combined with an external laser labiaplasty at the same session. Okay, and then finally, we have our AMSLA Chair. Our AMSLA Chair is using magnets which are flipping their polarity very, very quickly to generate an electric field. You sit on the chair fully clothed. Nothing goes inside of you. You're sitting fully clothed. This stimulation is aimed about 10 centimeters up, which hits that pelvic floor muscles that I showed you back in one of the earlier segments, that pelvic floor sling of muscles causing them to contract and essentially do Kegel exercises for you, approximately 11,000 Kegels in 28 minutes. So this treatment is fabulous for women who have had that stretching out of the pelvic floor, which has led to some stress incontinence issues. 6 sessions, usually twice a week for 3 weeks, and then some maintenance sessions throughout the year because it is tightening muscles. Okay, so that is just a quick summary of some of the changes that can happen in the pelvic area as we age and some of the potential treatment options to address those concerns. As always, if you have any questions, you can post them, but I recognize these are sensitive topics, so if you are more comfortable making a consultation appointment, come on in and we'll discuss it in private, in person. And finally, I just wanted to say that I recognize that these treatments are controversial in, this big scheme of treatments that we offer in plastic surgery. I am not interested in debating anyone on the ethics of these particular procedures. I am here to facilitate women taking ownership of their bodies, choosing treatments that make them happy and more comfortable. So if these are not treatments that you personally are interested in, that's totally fine, fantastic. But I don't believe in taking options away from other women. So if it's not a treatment for you, that's fine, but I'm not interested in hearing any arguments about why these treatments should not be offered to any women at all. So that's it for today's video. And as I said, make sure you post your questions and have a fantastic day with both babes.